This is a difficult session to moderate, not because of the quality of the ladies and gentlemen sitting here, except I. That is of extremely high quality, but because presumably all of you have had a good lunch, and today is a day which is at least 5 degrees warmer than it should be, and you're probably feeling very sleepy. So one of the decisions that we took before coming in is, instead of having everyone speak, as it were, will you finish your pictures? Thank you. Okay. That instead of having everyone do their 5-minute set pieces, then have very little time for question answers, we will essentially debate a very, very important question that faces everyone in the medical field, every practitioner, every doctor, whether the doctor works in a hospital, whether the doctor is running her own private clinic or any other arrangement, and whether the hospital is a private sector hospital or a government-run hospital. And that is the question of the growing perception of trust deficit. My grandfather was a doctor, my father's father. He was treated till the day of his death. He died while in practice. He was treated like a god, okay? I mean, that he was someone who saved lives, and he was treated like a god. That perception may not necessarily be very healthy, but it's certainly not there. Instead, we don't have a perception of being completely rational, knowledgeable about the doctor, about the practice that is being carried on your loved ones, about exactly what kind of interventions are taking place. But we have become increasingly so. The first principle is distrust. The second is to feel that patients are being finagled by the hospitals or by the dispensaries or by the healthcare system. And third is that the quality that should have been given in terms of care has not been given. They explode in the case of deaths, as we have just seen horrible episodes in Gorakhpur. But it does not Gorakhpur, it's everywhere. They explode in the case of deaths. They also explode otherwise. So I think it's best to discuss this as much as we can on what are the reasons that people here increasingly believe. So the first part is, what are the reasons for this trust deficit? That is very clear, that is taking place, that is being articulated. Second, what can the medical profession do about it, if it can do anything about it? And third is, what kind of responsible reportage, without ever once saying that the reportage should be in favor of hospitals when it should not be, what constitutes responsible reportage? So those are the three, and I'm going to start with Dr. Nandkumar Jairam. He's the chairman and CEO. He's a doctor for years, and he's the chairman and CEO of the Columbia Hospital Group. So, Dr. Jairam, on those questions.
Thank you, and good afternoon to everybody. Yes, there is a trust deficit, and this is unfortunate. And to answer the question as to why this trust deficit, I believe that the answer lies in two separate buckets. The first is about the patients themselves, and the other is about the healthcare fraternity. Let me take the healthcare fraternity to start with. There was a time when the doctor's opinion was considered God's opinion, as has already been stated, and people blindly followed what the doctor said. But that is past, that is history. And today, with the explosion of knowledge and the fact that medicine is not person-driven but evidence-based driven, it is absolutely essential that a patient is treated in a manner that is appropriate as defined by the textbooks and literature in medicine. The question is, does this really happen? And to answer that question, it requires the healthcare fraternity to be very cognizant that it has the need to communicate this to the patient in every respect, comprehensively.
Doctor, I'll come back to you. Just to keep you opened it up, and you'll have other ideas,
Sure.
so we'll come back to you. But you've opened it up, and this is a very important question. He almost tailed off this section when I interjected him by saying, does this really happen? That is, if you were to take a random sample of 10,000 patients who go to hospital for either an IPD or an OPD, or let's take IPD, 10,000, random sample of 10,000 IPDs, does it really happen that the patient is taken care of in a correct manner, in a scientifically proven manner, and that the fact that the patient is so taken care of is transmitted and shared with the patients? And I want to ask Sanchita your view. Does it happen? And after that, also Shabnam and Aarti.
I think it happens. I think, like anyone else, no doctor wants to kill a patient. Everyone wants the patient to get better. So definitely they are taken care of. But the problem today is that healthcare is becoming very transactional. So when somebody is ill, it's a very, very emotional moment for the family, and tempers run high. So I think the healthcare sector, unlike other industry, it's not just about the quality of services that you give. You also need to communicate with the family. You need to tell them why certain measures were taken, why certain decisions were taken, and I think that really becomes important. And increasingly, I hear from people that, doctors are not listening to me, or you hear from, and if the patient gets cured, the general perception is, oh, but I paid the money, I went to a good place, he got cured because I paid for it. It's no longer, oh, that doctor saved my life, or that doctor saved somebody's life. So I think that lack of one of the major factors is the transactional nature of the industry, which wasn't there 2 decades.
Thanks, Sanchita. Transactional, Shabnam, or anything else? I mean, and we'll come back to the transaction. I've written that down. Of healthcare, you said something very important, just like Dr. Jairam said. Healthcare is becoming very transactional, and we'll come back to that. But what is your view, Shabnam?
So I'd just like to point
on the trust deficit.
on
Why?
the trust deficit. So let me just put it in a different context. When you walk into a hospital or when you go and meet a doctor, it's not a place that you want to go to unless there are very few exceptions. Basically, the birth of a child where you're happy to go and meet. It's fraught with negative emotions. This is not a place you want to spend your money. So as it is, you're already on the back foot emotionally when you walk into a facility or you go and meet a doctor. The second very important point, why has the shift taken place from being a god to the transactional one that was mentioned? The world has evolved, changed so rapidly that current data shows that what I know today is not going to be relevant 4 years from now. So the exact data point is 4.2 years. Every 4.2 years, I need to change my skill sets. Now, a doctor, when they graduate from, for instance, in your grandfather's day, he was the one-stop shop. There was a limited repertoire of what medicines he had and how he practiced. So he was that one-stop shop. Now, the moment you come into a place where suddenly medicine has become this huge bouquet of services, very much like a buffet, and you say, hang on, I'll just see I'm not equipped to taking care of this problem, but I'm going to send it to Dr. X, who is the expert, then you are not viewed as being that God, and rightfully so. And as Dr. Jairam put it, in evidence-based medicine, I have to have evidence for giving you this paracetamol tablet, for instance. So this has woven into the psychology that we have not been able to have these various tracks move at the same time. So I, as the patient, say, hey, listen, I came to you thinking you're doctor, you're going to solve my problem, but now you're telling me I can't solve your problem, you have to go to Y, and you can't give me any kind of a roadmap to say what this Y is going to cost. And excuse me, but I pay my taxes. Why can't I go to a public hospital? Why do I have to pay it on for it from my pocket? So these are these huge differing thoughts in my mind, which is all adding to this entire ocean.
Let's move to Aarti. We're talking about A, the trust deficit, and B, whether this trust deficit is related to patients seeing healthcare becoming very transactional.
Yeah, what one gets to hear is there's no direct connect between a patient and a doctor. When a patient goes to see a doctor, the doctor depends on machines. I think that's the biggest disconnect, whatever the...
What you're saying is machines, while everyone knows enormously helps in the diagnosis, is creating a disconnect?
Yes, because, that healing touch of a doctor is gone. Machines have taken that away. I think that's one big thing which has happened. So you're not paying the doctor, you're paying for the machine. And this is for both private as well as public sector. Second thing is people don't want to go to a public sector because they think doctors, they will not take care of you because you're not paying. And when they go to a private sector, they think they've paid the doctor, so doctor should give all the time and all the attention, which doesn't happen. I think in both the cases, this trust deficit is there.
Trust, you're on the other side, you're on the patient side. A fair amount of insight on that, so.
Yeah. You're all on the patient side.
I know. In fact, I was going to say that all of us in the room have been patients at some point. So I've that's right. So I've been working in the field of understanding consumers and patients. I don't know if I'm clear. I think what everybody is saying on this panel is completely true for as long as somebody walks into a doctor's clinic, and I don't want to talk about hospitals by and large. So we're talking about the healthcare system. If the doctor is going to turn around and the first thing he asks you is insurance, hey, you know where the conversation's headed to, right? I mean, that is the unfortunate truth. Just to put things in perspective though, and I have to be completely fair to the medical fraternity on this, which is, I think the number of cases, chronic conditions which are now the norm, right? For example, and the statistics, so the 8 crore diabetic, patients suffering from or living with diabetes, and there are 10 lakh registered medical practitioners. So for as long as the statistics remains imbalanced, of course the doctor is not going to be able to spend time with the patient. Of course the patient has a zillion questions because they need to live, right? Of course there are how do I live better kind of questions, and if I don't get those questions and instead I am asked whether I have an insurance, where is the trust going to come in, That's the reality.
Trust. You actually meet patients in a very, some years
I'm a psychiatrist.
a psychiatrist, so he meets
Almost a doctor.
He meets patients and families in very difficult situations.
See, doctors perceived, people perceived there was some faulty perception about doctors being gods. They never were, they won't be. Yeah, reality had to come in, and I think that was just the way times had to evolve. I also firmly believe it's not about the money. I think we unfortunately end up thinking it's about the money. I don't think so. I think it's about how you are, is the money that you are taking the ethical one or not, and are you overcharging? Which means, am I getting something that should be there, or is there a lot of underhand stuff also happening? And you have to accept the fact that the deficit has happened largely across the board. And it's whether we talk about, and the reason behind that is, whether we appreciate or not, you would not find a more heterogeneous working environment than the healthcare industry, where you have from one level to another level, and even at the level of senior most doctors, the heterogeneity is so much. And the uniform, the collective conscious or the unconscious of the healthcare industry is so divided that there is no way a collective perception can be made which is positive. So the easiest collective perception is going to be negative until there is the conscience of the industry actually becomes one, which also includes the healthcare practitioners like me. I have to be able to think about how perception plays a part even when I talk about somebody else. So a large part of this is because it's human driven, person driven, personality driven, whether we like it or not. And I think that's what health industry needs to really look into.
Thanks, Amir. I want to get to Dr. Sorry, you had
No,
something
I
to
just
say?
wanted to, I disagree with Shabnam when she said that people don't want to spend money when they come to the hospital. I think this is like one sector where people do not have a problem spending money. Nobody will haggle about the price of a test or things like that. People want to get well, and I think that's important, and that needs to be communicated.
No, I didn't say they didn't want to. Once you're there, you will spend, but it is an event that you don't actually plan for. Now you're buying insurance, but you don't want to fall sick. No human being wants to fall sick.
Yeah, but then once you're in a hospital, you never.
Correct.
People beg, borrow, steal, but they spend on healthcare.
Agreed, but that's not a place you want to be.
Let me ask, move to, because we are moving into a very interesting area, and you're in charge of a very large set of hospitals, Dr. Jairam. Here's the question. If you wanted hospitals to be the gold standard in the eyes of patients, what are the 4 or 5 things you would ensure would happen come hail, high water, rain, or sunshine?
Thank you. That's easy. The first and the most important would be ethics and integrity. That would be the highest on the list. Number 2 would be a process and system-driven institution that enables patients to get the right kind of care. Number 3 would be a committed group of physicians who would communicate, meaning extend the communication to the maximum levels. And 4th, monitoring and auditing to ensure the highest levels of quality.
So vis-a-vis those 4 wonderful things, and they're very good ideals, where do you think we are? So let's take each one of them on a scale of 1 to 5, where 5 is perfect. What is your sense of where we are? I'm talking now only of hospitals, on each one of those 4 counts.
I believe you're referring to the industry in general.
Industry in general, I'm not talking your hospital.
Right. So,
that's not fair.
if you look at ethics and integrity, I would put it as a 3.5. It is fair to say that a good number of institutions, doctors, and healthcare in the country is still extremely ethical, and there's integrity. But it is the 1.
You know what 3.5 means, sir?
Yes.
It basically means that 30% are not.
That is correct, and that's where I'm coming from. What I'm trying to say is it is the 30% who are not that are responsible for the trust deficit today. And let me say squarely that that was the other bucket that I wanted to talk about at the very beginning.
Please go on. Please go ahead.
No. So it's the physicians who are not ethical that perpetuate the mistrust in the community. So that is on the first score. On the second, which is process and systems driven, it is very varied. And I think if you take the private sector and the private organized sector, I would say it's at 4 to 4.5%. Because almost all hospitals in the organized private sector, and I repeat that word, are very, very process and system driven. However, a large part of healthcare today is delivered by the unorganized private sector. And as you know, that accounts for about 80% of healthcare in this country today. That and the government sector are not as process and system driven as they should be. And that again is an issue. Communication and committed doctors, there is scope for improvement, and I can assure you that this is the other reason for the trust deficit today. I believe it is the duty of every physician to speak to their patients. And it was stated that the machines take over, and therefore there is a sense of disconnect. The answer is that that disconnect can easily be corrected if a doctor spends time and explains to the patient why he needs this machine. Patients are intelligent. It doesn't matter the level of their education. They are intelligent and they are capable. And to the last question of are we auditing and assessing quality? Unfortunately, no. Look at the number of hospitals in this country. More than 60,000 institutions. We don't even know the exact number. How many are accredited? How many of them really follow quality practices? It's close to 500. Look at the deficit. Look at the difference. Look at the large number of hospitals that need to set in quality as part of their DNA.
Thank you. You want to say something, Sanchita, just now?
No, I completely agree with you. I think what we really need to focus on is regulation, which is also the unorganized sector, the small clinics. People need to be accredited. And also what we need is accountability. Because what happens is when patients complain, often they do not see any action or any even inquiry against that doctor. So I think I think we need a lot more transparency in the sector, which is not there. And also you mentioned that if doctors took time out and explained to patients why a certain test is needed, I completely agree, that's true. But then the thing is, doctors often don't have the time, do they? Because I find that they'll say, take this medicine, this is a prescription. They won't even explain to you what is for what, why you need to take it, why do you need to take a certain course of antibiotics for a certain number of days. So I think that really is
I agree. And if I may butt in, one of the things people are saying is that the patient is getting treated, right? You don't talk to the patient. How about including his family in conversations? And that's one thing that again, research suggests, right, is the most lacking. Nobody bothers talking to the family. So it's really the family which needs a lot of counseling, it needs a lot of support. So while some people do, and I know all the hospitals probably present in this auditorium would, but by and large that doesn't exist in India, right?
Because healing is a very participatory process, and the patient and the families have to participate with the doctor.
I also feel that this entire thing about the time spent by a doctor, I think there is also a perceptual angle to this. So let me give you a pure mental health example. There can't be a better example than this.
I agree.
So if I were a psychiatrist sitting out of, let's say, NHS, the number of patients I would have seen in a day would be at least, if not 1/6 to 1/10 of what I would normally see. And if I wouldn't see these many patients today, with a 300% deficit of the experts, where would they go? So that's one aspect. Second aspect is when we talk about families, one also needs to understand that like any other group of people, it's not always that families behave in a cohesive manner.
Absolutely.
So one needs to look at that. I think what one needs to accept is healthcare is made by humans and healthcare needs to behave more like humans. We will falter. Accept it. We're humans. I will get angry. So be it. But I would also need to be human enough to accept the fact that I made an error. I don't need to shy away from that. And I need to focus on that element as well. Because the fact is, no matter how strong process driven we are, how much we audit and how much we look at our systems, that 20-30% of the deficit figure that we were talking about would be irrespective of where you are sitting. Whether it's an organization which is seen as far better or not wouldn't change, because the percentage of people who would be lacking, let's say, integrity is not going to choose the environment. It's there. It's going to be the same across the board. And that's what one needs to understand. We need to bring a more human face to healthcare.
Well said. Shabnam and then Bharti.
So I just wanted to grow on what Sameer said. and I'll go back a little in history to our own organization, where we had put the time spent with the patient and the patient's family in the early days as being 20 minutes. So within an hour, the computer system, HIS system, would not let you get the 5th appointment. You couldn't book the 5th appointment because it was capped. You had to spend 20 minutes. It created absolute bedlam. Patients were breaking down on the door and saying, why are you spending so much of time? I've been waiting, and how can you leave the clinic, and so on and so forth. This all stems from the fact that there just aren't enough people. I don't have to go into statistics. Each one of us knows it. The unfortunate truth that we face every day of our lives of people dying due to inadequate facilities, etc. But I think what Sanchita said very rightly is accountable. Now, in accountability, the most important part is you have to be very transparent in what you're doing, and you've got to have a benchmark by which I can hold you responsible. And I think that is where we collectively, either from the public sector or the private sector, have not spent enough time to say, what am I accountable for? Right? What am I accountable for? What should be this? Even if it is transactional, which is the kind of perception everybody has, what does this transaction cost me? And where can I go out? You open a newspaper today, you'll find all e-retailers there, Big Bazaar, this one, that one. So you know an average price of a particular product. Do we have similar exchanges? Have we worked on it? And the answer is no. Can we do it? Absolutely. And when we come to that point of maturity, that's when these things will start coming together. And what Samir said, the people aspect, the humane aspect will kick in once again.
Yeah, see, what happens is when there's no transparency and the family or the patient doesn't know what he's being treated for, and in the case of an unfortunate death or some incident, then there's a complete breakdown from the part of the family. That is what happens. And then you can't blame the patients because they've been almost clueless. That's one reason why it happens. And then you blame the people for being nasty. I mean, nothing can justify violence, but then you have to give them that space. Why they have reacted the way they have? Because they were completely in the dark. Even before you take a patient into a theater, and this is my personal experience, I wouldn't name the hospital. My father is a heart patient. He had to be taken for a surgery, and they suddenly decided at 6 in the morning he will be the first patient. I didn't have, my credit card didn't have enough money. I paid half of it. I said, let my sister come, you take him and we'll pay the... They kept him outside the theater. I mean, can you imagine how traumatic it was for the patient as well as the family? We were not running away. We had made all the payments. These are the things which create trust deficit.
Let me move on to some issues on the trust deficit. Is there, and here's a question for all of you, and with a complete caveat to start with, that there are outstanding, honest, ethical doctors, and can we have the phone off, please? And there are outliers. At the end of the day, patients go to outstanding doctors, they also go to outliers. Is there a perception, and I'm going to now throw this open to all of you as a question mark. First the question, and then we'll have the discussion. For all of you, is there a perception that doctors in our country make a patient go through more tests than is necessary in order to earn some extra money? Is that a dominant perception? If you agree, raise your hands. Now this is the reality, even though you raised your hands just so, but that is the reality. There is a dominant perception that this is indeed what doctors do without learning how to differentiate between doctors who don't and doctors who do. And I want to throw this open for debate, because we're not only talking of hospitals, we're talking of behavior of clinicians even outside of hospitals. So we'll start with you.
So I'm not sure I know what I should be saying, because it's true. I mean, of course you'll never, the sad part is because no matter whether it's 20 minutes or 25 minutes, and I wasn't suggesting at all that the doctor needs to spend time with the families, and you're right, I mean, some infrastructure could be potentially created if that becomes important. Coming back to this entire point is, I mean, what's the right answer? How would you know whether you need the test or not? So we are not qualified, right, as patients. And therefore there's suspicion. And remember, I'm the one who said that the starting point of a consult is, do you have insurance or not? And I'm not only talking about private practitioners, I'm talking about hospitals. So if that's the starting point, you'd always remain in doubt. So either you tell me, not when I'm a patient, because I'm on bed, I'm sick, don't talk to me. But when I am the wife or the caregiver of the patient, talk to me, explain to me why. Don't scare me, don't alarm me. I mean, what can I say?
Well, Doc, what does one do about this perception? It's such a dominant perception.
No, I agree. I mean, let's face it, today there are certain doctors who may succumb to financial incentives, and we've already discussed that. But the point really is for all of us to understand that there are mitigating factors and mitigating processes that can assure a patient, the patient's relatives and others that this is truly appropriate. And that comes under the realm of quality. I mean, I'll just explain one of the several methods by which this can be done. We have something called a peer review, which is a review done by an equally qualified person. And this person can go through the entire treatment and assure himself, the medical fraternity and the patient's family that all is well or not well. Now,
In terms of the way the treatment was done.
Yes. And this is just one of the several quality processes that are available. So all I'm saying is, firstly, the patient or the patient's family has a right to know whether justice was done or not. There's no question. Number two, and I say this as a response to what was stated earlier, I don't believe that the patient's relatives or the patients should take law into their own hands, which is the only unfortunate thing of today. I can assure you, no doctor, no healthcare personnel would ever object to a patient's right to know whether justice was done to him or not. And if justice was not done, whether a hospital or a physician should be incriminated and appropriately dealt with. I don't think there's a question at all. But really, there are several processes that we can resort to, and whereas it may be difficult for me to enlarge on all of those, it is about time that we as a healthcare industry invested in this universally to ensure that justice is done.
Sanchita, as a person writing on, in fact, for you, for both of you, as people who write and who have the power of the pen, and your job is to report, so your job is not to sugarcoat anything. How can this be dealt with from the perception of a person who writes?
What I find is we all talk about, you talked about peer review. The thing is, there's still a lack of accountability. If you look at the medical councils, complaints are made, but action is rarely taken against any doctor. So after a PowerPoint, the patient says, what's the point of complaining? Nothing's going to happen. And nothing actually happens, because we've done series on medical negligence. We just don't take any complaints that a patient makes, because you don't know whether the complaint is genuine or not. We only choose cases which have either gone to a consumer court, which have gone to a state medical council, and the cases go on for decades. It's people who file complaint die, and no action is the license is not even suspended for a week. So the fact remains, and I'm not saying all doctors are bad, because at the end of the day, they are good people. They're human beings, so they're good doctors and they're bad doctors. And which is why I think at the end of the day, a lot of the way this industry is driven, and we were talking about it earlier, it's not so much the processes, it's people. Word of mouth, that's the reason why it's still so important in the sector. You ask your best friends, you ask your family, who's a good doctor, who should I go to? That's the reason why, because the processes are not in place. And I think if you make an example, you talked about peer reviews. I don't know how many doctors were pulled up for wrong practice, and I'm sure everyone couldn't have, given the perfect prescription, given the perfect prescribe the perfect tests. So the thing is, you have to tell people that, look, we are a responsible hospital. If you complain, we are going to act on your complaint.
Thank you. Very, very, appropriate observations. And I'd like to just, make a point here. Firstly, it is not just the medical council that needs to be accountable. It is every hospital and every group of physicians. So accountability has to rest not with the government or the council. Yes, that is a body that is supreme and so on and so forth. But I believe that this has to be with the hospitals, and yes, it is not there. But yes, it can be incorporated, and this will come only if people come to know about the value of such processes. This is the first point. The second point, and I'd just like to make this observation, that it is unfair to believe that every patient who comes into a hospital will get well and go back home.
No, of course.
And therefore, in the eyes of the lay, either the patient, patient's relatives, the public at large, or for that matter, a lay person who's looking at this entire episode, unless the clinical aspects and the appropriateness of the treatment is discussed with somebody who is knowledgeable, you will not be fair to the treating doctor or the fraternity. And I just wish to state that an error of judgment on the part of the doctor, which can sometimes happen, is not to be mistaken with negligence.
No, of course. See, that's exactly what I'm saying. So which is why the peer review becomes important, and which is why it becomes important for you to communicate to the patient that, yes, we reviewed your complaint, yes, this is what happened, and yes, this is what we're doing about it. And that's something which is not happening in any hospital.
Yeah, so we're continuing to talk on transparency. We've gone into peer review. Again, from each of you, how do we ensure, I mean, we asked a question, we got the response. How do we ensure much more transparent, honest interface between doctors and patients, so that, inshallah, 10 years later, if we ask that question, only a few hands would go up and not so many?
I think Dr. Jairam, I'll answer this in two parts. I'll just put these points across. So Dr. Jairam, when he was asked about where does he stand as far as the ethics is concerned, and he said in the organized sector where processes are concerned, I would say in the organized sector we are at 4.5. Having said that, he said overall, because we have a very large unorganized sector of healthcare delivery, I'll bring it down to 3.5. And I think he was being very kind. The fact of the matter is that our lens, our eyes, our focus is always on that very limited portion of organized sector, where you have the ability to follow processes, have the peer reviews, invest in quality, and so on and so forth. The tragedy is that the larger part of the country is serviced by the unorganized sector. Now, when you have the unorganized sector, ladies and gentlemen, let's not forget there are many doctors, so-called doctors, who actually have no degree, who are actually practicing. You have a compounder who is sewing up and becoming a surgeon. These all collectively feed into the issue of doing the wrong things for the wrong reasons. As Samir put it, doctors are human beings. We are reflective of society. We are reflective of society. But having said that, I don't want to say all this is wrong and we are as good as gold. Far from the truth. But what we need to do is we need to help each other. We need to help each other to ensure that we follow the processes. So God forbid there is a problem, it can be appropriately addressed. But more importantly, what I would definitely like to say, that this will continue to grow unless we don't bring in the requisite number of people who can actually take care of you.
When we talk of unorganized sector, other than grievance redressal system in each hospital, which was just suggested, when you talk of unorganized sector, which is a huge sector in healthcare, I fail to understand there's a lot of resistance to this clinical establishments bill. I don't know why. Doctors may have their own reasons. I don't know, I'm not a doctor. But, you know, thing that goes out is, okay, they are resisting because it means accountability at every stage. So the private doctors don't want it. Government doctors don't have a choice because they'll have to do it. Private is opposing it because it will mean they'll have to spend money, they'll have to be accountable for every test and every diagnostic they do. I think that is another reason which maybe you will have to reflect upon. That could be one reason. And second, just a suggestion, a thought, maybe that sense of a family doctor, which used to be there about 10 to 15 years ago, should be revived instead of pushing everybody to a specialist even for fever or cold or cough. Maybe we can have that concept, revive that concept of a family doctor, so that somebody can talk even if he's not seriously ill. Maybe one crocin would do him good, but instead of pushing him to doing 110 tests which will do him more harm than good.
Samir, please. After you, but I think it's worth maybe from Dr. Jairam and others have a short 5 minutes on the rapid death of GPs. The rapid death of GPs is something we should talk about, but just after something. Yeah.
See, I sit on the other side of the spectrum. I'd rather hope there are more tests, because every second or third patient of mine tells me, you are telling me I have depression, you are telling me I have this disease, but where is the test? You don't do blood tests, you don't do MRIs, you don't do CT, there are nothing you do, and you give me a... Yes, you scored fabulously on a stressometer, I must say that. But I'll give you a mental health example. Look at where we were in mental health 15-20 years back, right? Look at where we are now. 20 years back, 25 years back, you wouldn't have had a psychiatrist on this panel, I can assure you of that. My parents still do not take it very seriously when anybody calls me for anything, because they still feel it really doesn't work. Mental health in our country changed, and the perception for mental health changed from people who are dealing with insanity and who themselves are not very sane, to the fact where you are coming about almost everything that happens in your life. I mean, from soft skills to non-soft skills, from relationship to parenting, you name it, and we are expected to give you an answer for everything in life, and life is very complex. The only thing we do is we just hear you out and don't say anything because nobody else is hearing you. But that's again a separate issue. But my point is, the perception changed because the interface between the society, a key role played by media, and the collective role played by a very, very small group of mental health practitioners, because the reality and the sad reality of mental health is that this sector is so small. And I'm coming back to what I said in the morning. The deficit is because it does not seem like a collective conscience. It seems like a very dispersed sense of self. In a dispersed sense of self, you will only have negative collective perception. You will never be able to build positive perceptions. Feel one first to create, even have an ability to influence perception. I don't think healthcare today is in a position to influence perception, because healthcare is not healthcare. It's healthcares, so many of them.
A quick one, Dr. Jayaraman, just going down to the memory lane question on the rapid and almost comprehensive disappearance of GPs, especially very good GPs and people, so many people going to hospitals for an OPD when a GP would have done.
Right. So I believe this was inevitable for two reasons. One, the explosion of knowledge that completely increased the volume of information that is required by any physician for performance of his duty, and the fact that technology has gotten to medicine, which means that there is so much more that has to be done and cannot be done by one single individual. This is one reason. The second reason is there is a complete end of the road for a doctor who does his MBBS and begins to practice, because he does not see a huge future in that role for himself. However, the good news is that India needs primary care, and there is a revival of primary care. There is tremendous investment into this space by more than one group of people, and you are going to find a different breed of the family physician emerging. These people would be much more system and process driven than their predecessors, and appropriately so. and they would be at primary care centers. I'm not talking about the primary care centers of the government type, but primary health clinics put up with appropriate infrastructure to support people who would pass through the primary care as a gateway towards their health. This is coming. You can be assured.
Okay, what we'll do is we have a total of 15 odd minutes left. We'll spend 10 to 12 minutes on questions. I think each one of us has had sufficient experience with doctors, be it in hospitals or outside, and each one of us wishes to see a less contentious and a better working relationship between society and doctors than we have seen in the recent past. So let's get questions for the panel or ideas that come from any one of you. Yes, sir. If you can introduce yourself. Someone. Yeah, would you just be somewhere here so that the mic can be passed around? Yeah, thanks.
Hi, just two small observations. My name is Dr. Sanjeev Bagai. I think medicine has changed tremendously in the last 15-20 years. I think the expectation and demands of patients, because they have become more knowledgeable about their own disease, they become a part of the decision-making cycle. They want to be so. I think it has changed. So the number of diagnostic tests which are available and justifiably ordered has increased. Tests are expensive, and the burden invariably, because of lack of insurance, does come to patients. But I think there are two tangent points in this. One is what MBBS students and MD students, MS students really lack, even in the present date in their curriculum, is soft skills and communication. I think that should become paramount importance. In a busy day-to-day practice, we fail to actually understand that the patient is beyond a name and the person is suffering, and we need to address that. Point number two is when it comes to hospital-based doctors and patients, most private hospitals and government hospitals have internal audits. They have medical audit committees, they have other financial audit committees, they have test audit committees. The sector which goes unregulated is the private practitioners and the GPs at large. It's almost impossible to monitor such a large community because it's at loose ends. But I think the media has a tremendous role to play. I think doctors, like I said in the previous session, also at the receiving end as a common denominator of being flogged because of lack of infrastructure, lack of medical professionals, lack of money, lack of insurance. So let's slap the easiest person as a doctor. I think that has to stop. Doctors otherwise would become a dying breed. And I'm saying this very strongly. Good students are not going to go in, they're not going to go in, they're not going to go in. And they need a lot of protection, not only against doctors' assault, but I think more understanding. You do not expect us as human beings who've spent about 8-10 hours in the hospital at night to come smiling for a 9 o'clock OPDs. We are human beings, we have emotions, we have reactions, and there are counter reactions. Healthcare in the private sector is a misnomer that it's expensive. Actually, it is not expensive. If you really look at towards not only the cost of investment, but overall as an international level of care, you want that kind of results, so that much amount of money will be spent, but judiciously. I think there are some good doctors and there are bad doctors, likewise in lawyers, likewise in engineers, and likewise as all human beings. But I think doctors need a little bit more, the reverse way, more empathy and understanding. Doctors need to be understood a little better.
Thank you.
May I just jump in and add to what he's saying? I so completely agree with what you said. And I do believe at some point media too could stop doing sunsoning all the time about, bad doctor and good doctor. It's just a little judgmental sometimes.
Yes. Yeah, so I have been a patient for last 1 year, and when you're talking about doctors, I think some of the hospitals in Delhi you have the best of the doctors, so people don't have any issues with doctors. The top 3 hospitals in Delhi, I don't want to name any one of them, I have been to all 3 of them. The basic problem right now is in terms of empathy. Number 2, what has happened is that hospitals have become a business model largely. So the moment you check into a hospital, you will get a message through the CRM, how was your check-in process, how was this. But as a cancer patient, if you go alone and right from your billing to your counseling to anything, all that job is kind of subcontracted. So those people have absolutely no understanding of how to treat you, how to talk to you. And some of the equipment, it is so, I would say, grossly misused that you are sitting for a radiation and then you realize that every half an hour that machine is, getting out. And these are some of the best hospitals, and then you have to go to the CEO and talk to him. So my concern right now is that if you want to talk about patient care in terms of empathy and all that, as Dr. Bagai very rightly said, the whole process needs counseling. The people whom you employ, each one of them needs to be trained. And they have to understand that the patient who is walking, money is not the problem. The problem is that how you are dealt with.
Thank you. The gentleman behind you, you've also got a mic there, yeah.
I'm Dr. Sankhe from Mumbai. What Dr. Jairam said about those 4 things in a hospital which will prevent such kind of issues. But if you recollect the famous case which came on Satyameva Jayate, all these things were there already. The doctors were trained from the best hospitals in US. It was a transplant complied hospital, so it had definitely good qualities. And still, patients did perceive that it was a cheating case, which was not. Because I'm a doctor, and also in my own hospital, all these 4 things are existing. But today what we are seeing is what our discussion is going on, we need to go a little deeper, because there is a definite degradation in the whole value system of the whole society. The conscience of the whole society has gone down. There is trust deficit at husband and wife level. There is trust deficit between the politicians and the common population. There is a trust deficit between bureaucrats and all of us. 2 bureaucrats, they were here, they just walked off from the panel discussion. It was very rude. So I think the spirituality, which is a hallmark of India, should be revived. The spiritual health has to be revived so that the value system comes back, and with that we can address this.
Yes.
Thank you very much, sir. My name is Tenzin. I am an engineer MBA. So basically part of a startup. We are in the healthcare fintech space. So it's been last year plus, 12-month plus kind of a phase in which I have personally been involved with. So we cover around 300 hospitals in Delhi. We help patients reach out to hospital for surgeries and also give them medical loans. So I'll come to trust, where we are trying to solve trust to various levels. So few observations which I believe from the panel also. So I would say trust in 2 phases. One is the part where patient want to reach out to the right hospital, and second is once he is getting the treatment. So I personally want to look at it purely from a data-driven exercise. Ethics and emotion, etc. are very strong, but at times they are subjective. So one part where we realize that, for example, IRDA releases or rather captures data from insurance companies which are on outcomes of clinical outcome data which sits with it. Though we are trying through RTI whether such data can be gathered. Point is, sir, that can that be used to create some kind of a...
So here's your question. The question is that at least for the larger hospitals where such data are available, could such a data be used by an aggregator to give options to people as to, like policybazaar.com, could there be a hospitalbazaar.com, right?
So idea being, sir, that once it is data-driven exercise, you can bring transparency.
Sure.
Please, sir.
So could there be a hospitalbazaar.com? I would have thought...
A lot of hospitals are not keen to share data. So if I need to know the infection rates in a hospital before I'm admitted, if I need to know the survival rate, outcome rates, I don't get it.
And even if they were, we'll discuss this later, even if they were, I think there's an ethical issue about having hospitalbazaar.com. Even if all hospitals shared data, there would be an ethical issue as distinct from policybazaar.com.
I'm Ashish from Innovation Analytics. I just wanted to point out something, that there could be something as hospital to compare the hospitals. Moving on, I have a follow-up question. We were discussing about...
Sorry, before your question, Dr. Jairam has, when I said that there could be ethical issues, he told me not to, and he said we should do it.
Yes. So I think, and I'm sure that the entire community of healthcare in this country would agree that appropriate, accurate data needs to be present, shared in an anonymized fashion in order that patient privacy is not compromised. And doing this is the only way forward for us to establish appropriate healthcare in this country.
Yeah, I just like to...
Sorry, Rahul, yeah.
I would actually say, why anonymize? As long as the data is standardized.
As long as the measurements are standard and the way to measure them is standard and the auditability of that measurement is standard, then to my mind there is ample opportunity. And I think Dr. Jaram, you and I both know, in many developed countries there are several measures of this kind, including hospital-acquired infections and so on and so forth, which are very open.
Data is there because you're sharing it with
And by the way, there are accreditations which are well recognized internationally, such as JCI and so on and so forth. They're not going to give you these accreditations without this sort of data which is available. So of course, it's possible.
Actually, sorry, Omkar, just to complete the loop on this, Niti Aayog itself has a rating thing.
Correct.
Just go to their website. They just released it 2 months ago. For government hospitals.
If I may add, I would say data is of two kinds, sir. When we talk of... Sir.
We were discussing about accountability and transparency with trust issues. We also want affordability and quality care. But something here is missing. I think we should also bring in the question of bringing incentives for someone delivering good care at good cost. Why should someone be motivated to give quality care without any incentive from government or from insurance companies?
Okay, there was a gentleman there, and then we'll wrap it up. And one more, yeah. No, just grab any mic. Just go there and speak. Yeah.
Good to see you, Omkar. I'm Anjan Bose, Secretary General Nat Health. I just, I was reading the points for this session, and I'll request our media colleague to comment on at least one or two of these points.
Thank you. There is no doubt that out of 100 sectors, this is the sector where many of us have grown up, has the maximum trust deficit. No doubt about it. The subject of this discussion was role of media and how media can perhaps influence bridging this trust deficit for the good of all of us. So I just want to pick up a couple of points. One is sensationalizing exceptions as norm, the need for more positivity, and should media be the conscious keeper for healthcare? So I just have a question for our media colleague, that what is balanced journalism? How can responsible journalism influence sort of reversal of the rot that has set in?
Yeah, okay, sure. Shall I take it first? Okay. See, you have to understand how media works. Our job is communication. When we set out to do a story, we don't say it's a good story or a positive story or a negative story. You don't set out to sensationalize. When you want to share a story, it has to be something people are interested in. And as we ask the question here, when people go through a bad experience, they identify with it. And you cannot say that, we're just doing stories against the healthcare sector. In fact, because of the topic of the session, I went through some of the stories we've done in Hindustan Times over the last 1 month. All the series we've done it on infectious diseases in the monsoons, and I'm talking about half-page, full-page packages. We've done it on AIMS, providing free tests to patients. We're now covering the Gorakhpur deaths. So it's not that you're saying doctors are failing, and it's just that the job of the media is to hold a mirror up to what's happening. And if things are not working, you can't expect us to sugarcoat it and tell people that, hey, things are wonderful and, you should ignore it.
With your permission.
Yes, of course.
Not at all. I think some of you have done splendid work in terms of bringing up innovative good work that is going on. But the intent of my question is not to question the media. The intent is to ask, can you highlight those excellent work that is going on along with all the other
things? No, but
it's
done already. That's the problem.
Sorry. Okay.
Okay. It's done regularly, not only good work, but even the government policies and programs which are being run by the government are, I think, reach the people only through media. I think that's the
Can I
biggest
just add
service we're doing.
something? I think it's people. You just remember the sensational stories. That is the problem. Those are the
Sanchita,
stories which have the highest recall.
In fact, more important, I think my take on this is I don't think the onus is on the media. I don't think the nature of narrative by the media, the onus can be on the media. The onus has to be on healthcare. On healthcare.
On this one,
I have to also play a big part in what it can't be. I just can't put it all on media. I don't think that will be fair.
I'm sorry, we're running out of time, and the guy sitting to your left, he has to sing for his supper, so I'm going to put an end to this. Look, we can discuss this till the cows come home. And if it's a mad cow disease, then we can discuss about how, doctors are, how vets are not doing a good job, right? But it is a serious problem. I think we are at a crossroad. We are at a crossroad where a large number of people have, quite rightly, much greater voice than before. Some attributes of that voice is violent voice. Much of the attribute of the voice is voice. And we have it. And in fact, it is that voice that keeps this country together. I mean, there is nothing in common between a person in Nagarcoil and a person in Jammu Tawi. It is other than the fact that the person from Nagarcoil and Jammu Tawi both believe they have God's given right for unlimited voice, right? And this, but it is, as you said yourself, this voice is coming strongly against several things, of which the medical community is one. It is going to, whether we like it or not, how many FICCI seminars that we have, this voice is going to get stronger. It will have some terrible violent parts to it. Some of it we will not be able to control. But at the end of it, I think the moral of this voice is for physicians to ask themselves a question, and it's a simple one, that physician, heal thyself. Because by healing thyself, the voice won't go away, but it will be modulated. We have now in a situation where I think doctors face more challenges than they have ever faced in the last 100 years. Some of them are very good challenges, but that's the fact of life. Mr. Khosla, your time to sing.
Thank you, Omkar, and thank you to the panel. First of all, give them a big hand, please. I will have a very good supper because I think a lot of these people sang very well on my behalf. I don't need to do much more. I just want to say that as we were thinking about this session and as we were trying to put it together, there was a lot of trepidation amongst a lot of people that, look, this is going to be quite explosive. And how do you bring all of these elements into one powder keg which is going to explode, because there's so many sentiments and it's such a touchy and very sensitive topic. So congratulations on doing a very thorough job. I think you've touched on so many things that I find it, despite what you said, Sanchita, and what you said, and I agree, there is a decent amount of coverage which happens. But I cannot help but saying that in the last 1 hour, the degree of interest, I think, in this room reflects the seriousness of the issue that's being debated. And I would only urge our representatives here from the media to be even more, not only vigilant, but actually try to dig even deeper into what actually matters. And somebody said, you need to put up a mirror to what's going on. Actually, much more is going on than even your reporting, despite the fact that you're doing a good job. I think there's much more that can and should be done by going behind the scenes and actually not only just reporting events, but also analysis, because I think that analysis will help to educate. So I agree with you, Sanchita, that people are going to read tomes of how procedures are done because it just doesn't make interesting news. But look, let's borrow from let's borrow from, let's say, the financial services industry, where there's a lot of literature, not just on events, but also on the analysis behind those events. And I do believe that the community here, across the board, needs that sort of knowledge, and the best representatives and the most balanced representatives would be yourselves, rather than healthcare providers or healthcare practitioners or government or anybody else, because your voice is going to be the most believable. So one request really is to go deeper behind these things, and do come. In fact, I just finished a meeting over lunch where we euphemistically said we need a bunch of what I would call intelligent journalists to sit down and actually have a very intrusive debate, if you will, because there are many facts which I don't think are known, some of which were touched upon here, but I think the implications of those facts will be very important for you as journalists to know. And then you can do what you wish with it, but at least get those facts, research them, dig deeper, challenge them, but then at the end, take out from that a degree of balance that you will be able to get. And I think that's what Anjan was trying to say as well, to some extent. Okay. Thirdly, I think you have touched upon a lot of human emotion, and I think this is a very strong sense that, look, let's just face it, we are human, errors will happen, and I don't think we should get too upset about the fact that those are reported and so on and so forth. I also think it touches on a very much bigger aspect here. Look, we are facing a tsunami of shortage, I'm sorry to say that, of doctors, of nurses, of beds, of infrastructure. Let's not kid ourselves. Who is going to, and you know, before, I don't know when it was, before lunch, Shobha, where are you? There was this press conference which I was fielding, and quite honestly, I mean, the sentiment over there was, how will the poor and the rural in this country, and in tier 3 and tier 4 cities in particular, or the urban poor, access healthcare? And I'm saying, who's asking this question? Who is actually digging deeper and saying, what does the government of the day need to do to be able to actually be accountable to its own citizens? And so, if you have private enterprise in healthcare, you will get a profit motive, you will get a certain behavior, you will get errors and so on and so forth. But if you want universal health coverage for this country, and many people here have actually said the right thing, and look, notwithstanding all the mistakes that are made by doctors, hospitals, healthcare providers across the board, and no one is denying that isn't so, I think the media can play a very big role in making sure that the allocation of funding and support for making universal healthcare happen is pressed upon to the government of the day as well. Because as somebody eloquently said, if you just walk out and say and do nothing tomorrow morning, nothing's going to change. So please, you know, our appeal would be to keep at it. In the end, just thank you very much for, I think, a very rewarding and a rich debate, and I have no doubt that it will take it away from here, hopefully with more meaning. Omkar, thank you for curating the session. Really appreciate it. Thank you.